This is Dr. Rohit Reddy. I am a consultant medical and hemato oncologist currently working at Yashoda Hospitals, Malakpet. So today we'll just briefly discuss regarding the recent advances that are happening all over the world, especially with the field of blood cancer. As you all know, we have two broad variants of blood cancers. One being the acute leukemias, which is deadly. Patients are often sick and they may also die if untreated. The other one is chronic leukemias, where patients go on for months, years, symptoms, and later on they get diagnosed. Now, what is happening new in 2025 in this field of blood cancer? Now, we are moving to an era where we might not have to use chemotherapy at all for patients who have blood cancers. Now, we have various other therapies such as targeted therapies, immunotherapies, and CAR T cell therapies, where you might even get away without taking chemotherapy. Now, what is the advantage if you do not take chemotherapy? You can avoid all the side effects such as hair fall, fever, and many other complications which, as you know, may occur due to chemotherapy. Now, artificial intelligence is rapidly moving into the field of hemato oncology. So nowadays we are using artificial intelligence, or shortly known as AI, in the field of diagnostics. We can easily diagnose patients who have blood cancers. We can easily classify patients who have blood cancer. We can also identify if there are any novel therapies pertaining to this patient. And there are also certain tests such as circulating DNA tests and cell-free DNA tests, which might help predict a patient who can easily relapse after the therapy. There is a new field of therapy in blood cancer called as cellular therapies. Cellular therapies are especially pertaining to the field of bone marrow transplant and CAR T, which is being routinely done in Yashoda. Now, patients who did not have cure prior now are living longer because of these cellular therapies such as bone marrow transplant and CAR T cell therapy. Especially CAR T cell therapy, which was very expensive in US and western part of our world, now has arrived to India, and many patients are using indigenous CAR T molecules which can help them get cured. Finally, survivorship. Nowadays, as we all know, various cancer therapies cause a lot of complications, and they might result in survivor issues, especially like infertility, depression, and psychosocial abnormalities. Now, we have cancer survivor groups which can help all these patients who have undergone various kinds of therapies and help them rehabilitate better, help them in settling into the society, and also probably regarding their fertility. And thank you very much.
Like, comment, and subscribe for more health updates.